Hi, Jordan, and thank you for taking a few minutes to talk with me today. As part of every dental hygiene appointment, I ask all of my clients about tobacco use because it can have a significant impact on both their oral health and their overall health. My role is to support you, answer any questions you have, and to help you find strategies that work best for you. Would it be okay if we spend a few minutes talking about your smoking today?
Sure.
So, do you currently use any tobacco products such as cigarettes, cigars, vaping products, or smokeless tobacco?
I smoke cigarettes.
Thank you for letting me know. And how many cigarettes do you smoke in a typical day?
About a pack a day.
And how long have you been smoking?
Around 12 years.
Have you ever tried to quit before?
Yeah, a couple of times.
And tell me a little bit about those experiences, what it was like when you tried to quit.
It was hard. I had cravings and became stressed.
It sounds like you were really committed to quitting, but the cravings and the stress became overwhelming. Quitting isn't easy, and many people make several quit attempts before they are successful. What do you think helped you the most during those quit attempts?
Staying busy and exercising.
Those are great strategies. And looking back, what do you think made you want to start smoking again?
Mostly stress. I eventually just gave in.
So stress is really one of your biggest challenges, and that's helpful to know because it means we can build a plan that focuses around managing your stress differently this time. What situations or feelings usually make you want to smoke?
Stress and drinking coffee.
It sounds like stress and your morning coffee have become strong smoking triggers. What concerns, if any, do you have about continuing to smoke?
I worry about my health.
It sounds like you're thinking about how smoking can affect your future health. What are some reasons that make you want to quit?
I want to be healthier and save money.
So improving your health, saving money are really important reasons for wanting to quit, and those are excellent motivations. It sounds like your health is really important to you, and you've already shown that you are willing to try, and that takes determination, and you should be really proud of that and that you haven't given up. On a scale from 1 to 10, where 1 means you're not ready at all to quit and 10 means you're completely ready to quit, how ready are you to quit smoking?
An 8.
That's great. And why an 8 instead of a lower number like a 4?
Because I know smoking is hurting my health and I really want to quit.
Those are really powerful reasons, and it sounds like you've already decided that your health is worth making this change for. What positive changes do you think you'd notice if you were to quit smoking?
I'd breathe easier, save money, and just feel better overall.
It sounds like you already have a really clear picture of what success looks like. Breathing easier, feeling healthier, and saving money are meaningful goals to help keep you motivated. As your dental hygiene student, I strongly recommend quitting because it is one of the best things you can do to help improve your oral health and your overall health. I have a little picture here, and this will show you that smoking can increase your risk of gum disease, bone loss around your teeth, tooth loss, delayed healing after dental treatment, oral cancer, bad breath, and tooth staining. Smoking also reduces blood flow to your gums. So gum disease can sometimes be harder to detect because the gums may not bleed as much even when disease is present. How do you feel after hearing all of these effects?
It's concerning.
I can understand why, and the good news is that quitting smoking can greatly improve your oral health over time. Your gums begin healing almost immediately. Smoking can also increase your risk of lung cancer, heart disease, stroke, high blood pressure, and diabetes complications. Secondhand smoke can also increase health risks for family members and children. If someone smokes during pregnancy, and it can increase the risk of miscarriage, premature birth, low birth weight, and sudden infant death syndrome. After hearing all of this information, what concerns you the most?
Probably losing my teeth and developing serious health problems.
It sounds like preventing those long-term health problems is really important to you, and that's helping motivate you to make this change. Based on everything we've talked about today, it sounds like quitting is important to you. Would you like to quit within the next month?
Yes.
That's great to hear. And what makes right now feel like the right time?
I want to improve my health before it gets worse.
It sounds like you don't want to wait until smoking causes more damage before taking action. Would you be willing to set a quit date, let's say, within the next 2 weeks?
Yes.
Perfect. So let's choose that quit date for 2 weeks from today. And now that you've chosen a quit date, on a scale of 1 to 10, where 1 means you're not confident at all and 10 means you're extremely confident, how confident do you feel that you'll be able to quit?
I'd say 7.
That's a great starting point. And why do you think what do you think would help move you from a 7 to an 8 or a 9?
Having support from my family and finding ways to manage stress.
Those are excellent ideas. It sounds like having support and managing stress will be important parts of your quit plan. Since stress is your biggest trigger, let's talk about some strategies that can help when those craving happens. So some really good ideas when those cravings come on are going for a walk, exercising, deep breathing, drinking water, chewing some sugar-free gum, keeping your hands busy, calling a supportive friend or family member, avoiding smoking triggers during the first few weeks. Which of these strategies do you think would work best for you?
Walking and exercising.
I like that you're choosing strategies that have already worked for you before, and this gives you a really strong starting point. There are also some medications that can help. Would you like to hear about those?
Yes.
So these medications that can help reduce cravings or withdrawal symptoms. Some are some nicotine replacement therapies, and they're available over the counter. And they're nicotine patches, gums, inhalers, and mouth sprays. And these products provide controlled amount of nicotine to reduce the withdrawal symptoms when you're quitting. The cost depends on the product you choose, but it's also available without a prescription. There are also prescription medications. One is Zyban. It's classified as an antidepressant, but it works by increasing the dopamine and neuroepinephrine receptors in the brain. Some common side effects are dry mouth, headaches, and dizziness. There's another medication, it's Champix, and Champix is specifically designed to help people quit smoking, and it works by partially stimulating the nicotine receptors while also blocking the nicotine from cigarettes. And this helps reduce cravings and makes it less satisfying. There are some common side effects with that, like nausea, headaches, and difficulty sleeping. Both Zyban and Champix require a prescription from your doctor, and the cost depends on your insurance coverage, but you can call your insurance and your work, and there are programs to help with the medication. So how do you feel about using medication as a quit plan?
I think it could help.
I'm glad you're open to exploring those options. So I'd recommend reaching out to your doctor so that you can determine what one is best for you. I'd also like to provide you with a few resources here that can help you. So this is the Smokers Helpline pamphlet, and it provides you with a free phone number where you can talk to free quit coaches, ongoing support. I also have the Canadian Cancer Society one where this has withdrawal symptoms preparing you to quit. And I'd also recommend downloading an app, and it can help track your smoke-free days and see how much money you've spent and saved. And how does that feel for you?
Great.
That's wonderful. Sounds like you have a good plan in place. So I'd like to follow up with you about 1 week after your quit date, either by phone or at your next dental hygiene appointment. We'll celebrate what's going well for you, and we'll help with any challenges you need. It's also important to remember that it takes several quit attempts sometimes for people to be able to quit, and you're doing great. So in summary, I'd like to summarize everything. And so we've talked about your smoking. Your biggest reasons for quitting are improving your health and saving money. We've identified stress and coffee as your biggest smoke triggers. We've identified some ways to help cope with those triggers and things to do. We reviewed nicotine replacement therapy, Zyban, Champix, including how they work, cost, and possible resources for your quit journey. And I'd like to follow up with you. I'd really appreciate how honest you've been today. You've identified your reasons for quitting, your triggers, your strategies that have helped you before. Remember, quitting is a journey, and every step you take is positive towards going about your oral health and your overall health. Before we finish today, do you have any questions about quitting smoking?
I don't have any questions right now. I actually feel much more confident after talking with you.
I'm really glad to hear that. Remember, you don't have to do this alone. We're in this together, and we'll continue to support you throughout your quit journey. And I'm looking forward to hearing about your progress at your next appointment. I'm actually going to give you these pamphlets and a document that outlines everything we've talked about today. Thank you.